The address is the Goodwill. It's on Beachmont. The address is 4051. I have a man here. He's been injured. He's been hit by an automobile.
Any given moment on any given day, somebody calls 911. Some kind of incident, accident has occurred.
Every second made a difference in this baby's life. Seriously, every second made a difference.
You know, our thoughts were that he could very well have died from his injuries.
Without the paramedics here and without the air flight here, he would have had no chance at all. They gave him the opportunity to survive.
Actually, we just celebrated, 2009 was our year to celebrate our 25th anniversary for Air Care and Mobile Care. And we do have a long, very interesting history actually, is Air Care was originally started with the founder of Air Care, who was Dudley Smith, was the original director of Air Care. And it was his thesis project for his master's at school. And he was at the University of Cincinnati and working with, they actually started an ambulance service over at the University of Cincinnati 30 years ago, and from that it became his thesis project, and it took a couple years to develop. And with that, they started with an aircraft based here at University Hospital 25 years ago, and been doing transports and growing and evolving ever since. The mobile ICU, there was a need for that critical care transport to start, and that was originally initiated at Christ Hospital through a group of cardiologists that needed to transport their patients from some of the rural areas into the cath lab. So they started a mobile ICU team, and shortly after that, then they started a basic life support team to support transporting the patients out of Christ Hospital. So there's two different things working kind of at the same time, and that with the evolvement of the Health Alliance, it made sense that, you know, we bring all these resources together and make it one comprehensive service to provide a wide spectrum, so it becomes a one call, can do it all for whatever need the patient needs. So that's where the BLS, the ALS, and the mobile ICU and the rotor wing came together to work as a unified group.
The main difference between the two, in particular for our program, is the time factor. That truly is the big deciding factor. The physician component is important, so sometimes some interfacilities would prefer to have a physician on board and therefore would call us. But the way we train our staff, the ground nurses and the air nurses, both teams are trained exactly the same, so they can deal with the same patient populations. But the time factor would be the determining factor between sending one over the other.
I think there's a deep analysis of what type of patients need to be transported. What is the need? What does the community need? So if the patient needs happen to be a critical care, then you have to look at the scope of practice of the various practitioners. So what level of care can a nurse provide? What level of care can a physician be able to provide for those patients, or a paramedic or EMT? And identify the need, and then match that need with the most appropriate level of healthcare provider.
The main difference is the educational level of the physician, the ability to diagnose more in depth, and therefore allowing some different interventions. Allowing to know what the hospital is going to be doing when we get there, so we're able to start procedures or interventions that'll easily be carried over to the hospital setting. So a lot of the things that you do in transport, a lot of it is pretty defined by some guidelines and criteria nationally, but having the physician on board gives us that extra edge as far as knowledge and capabilities, and just further diagnosis that helps the patient in the end of their process and their visit to the hospital.
I think that, and I'll speak mostly on the air side, since that's where I spend most of my time. I think that people kind of mistakenly think of helicopter EMS as solely something that has to do with trauma. And, because that's where we're most visible when we land on I-275 to take care of a patient injured in a serious car accident. And that's kind of when you see us on the news and so forth. But trauma is actually a little less than half of what we do. So you need to kind of, I guess, broaden your perspective of what air care does. We fly an awful lot of patients with heart attacks, with strokes, a lot of pediatric patients. About 11 or 12% of what we do is pediatrics, and not just kids injured in trauma, but also sick kids with status asthmaticus or status epilepticus or sepsis. A lot of patients with high-risk OB, obstetric transport. So there's a great variety in, as you mentioned, not just in emergency medicine, but in helicopter EMS as well. And so that's why it certainly does take a lot of training to be ready to do this job well, both from a nursing standpoint and a physician standpoint.
And the uniqueness about air care is the fact that we fly with a physician nurse in the back, and we're only one of less than 5% of the programs across the nation that are still able to that have that level of support from their facility to continue that. And what that allows us to do is really open the doors up from University Hospital and take that hospital out to the patient.
Usually on the mobile ICUs in the aircraft are where we use our critical care nurses. We have a total of about 23 nurses on staff with us right now. There's probably an average of about 20 years of experience between all of the nurses that we have. For criteria for this position requires at least 5 years of nursing experience. So, and that's in either an ED or a critical care setting. We feel it's very important that nurses have at least 5 years of experience to be able to deal with the issues that arise in an outside of a hospital experience. So that's very important. We prefer to have people with pre-hospital experience, so if you are a nurse and also an EMT or paramedic, that's very highly sought after. If you have both adult and pediatric experience, we look for that as well. But we do require, of course, basic life support, advanced cardiac life support, pediatric advanced life support, neonatal resuscitation, and advanced trauma courses like a TNCC or an ATLS type of a course. And we also require our nurses to have a national certification within 1 year of hire here. So our requirements are pretty steep, but our patient population are very sick. And we can see that just in general, health of patients are sicker. So we need to be able to have people who are able to deal with those in a different situation outside of the hospital.
And it's a deep, dark secret. We don't tell people, but the nurses know way more than we do.
Yes, I have been with University Air Care since the beginning, so it's been 25 years this past November. And I'm the only existing flight nurse from the beginning of the program. We had 5 full-time flight nurses initially and a couple part-time. So over the course of the 25 years, we've had nurses that stayed a long time. We actually have some that are probably 22, 23 years at this program. So we have a pretty good track record for keeping nurses.
I always knew that it was one of the best flight programs in the country, one of the very few flight programs that flies with a physician and a nurse, which is the highest level of medical providers that you can get on a helicopter.
In order to get a job as an air care flight nurse, you meet much more rigorous standards than the government would say you have to be a flight nurse. So you have to have a minimum of 5 years of nursing experience in critical care nursing, be that in the emergency department, in the ICU, or at another program in flight nursing.
Yeah, I went into nursing to get this job. Not just to be a flight nurse, but to be a flight nurse at University Air Care.
On average, if you look at all of our flight nurses, they have 18 years of critical care flight nursing experience. So we are very fortunate to fly with the best of the best in the flight nurses. Every flight we have an emergency physician, a flight nurse, and a pilot. If you look at helicopter EMS in the United States, that is quite unusual. Again, there's about 400 flight programs, give or take, in the United States right now. And of those, there are